I was just looking for that perfect diet. And I would sign up and pay thousands of dollars to any program that promised me quick and easy weight loss because I was desperate. I couldn't stand to be in my own skin.
Why is losing weight so difficult? When we do lose weight, why do we often gain it back? Today on Health and Family, we visit with Dr. Sandy Van to learn more about the science behind weight loss, and Sandra Elia of Obesity Matters, a community of hope and support.
I chose to focus on weight management as a physician because throughout my residency training as a family practice resident, I noticed that a majority of the patients that I would see in practice were presenting with concerns that were related in some way to their weight. And I felt like treating their blood pressure or their diabetes, although helpful, would also be largely more helpful if I was actually treating some of the root causes, which was related to excess weight.
Many dealing with weight loss maintenance issues realize it's not that simple to lose weight and keep it off. What they may not know is that there are biological mechanisms that make weight loss maintenance difficult.
So in my 20s, I went to my doctor and asked for help with my weight, and she made it very clear to me. She said that the formula was calories in versus calories out, and it seemed so simple, and yet it was something I could never do. And so my weight increasing year after year meant that I would no longer go to the doctor.
So the paradigm of telling somebody to eat less, move more is very antiquated. We know that it's wholly unhelpful for people. The treatment strategies we use today are meant to be individualized to the person. Oftentimes what I see in my own practice is that patients have come to me and they've been through the ringer with their weight loss interventions. They've tried everything under the sun. They know about diet better than most people, even doctors, but yet nothing has worked. And they often attribute that to a moral failing. And the reality is that there are biological underpinnings that cause this reflexive weight regain to occur. And much of that rests on this idea of the set point theory, that there's a part of the brain that recognizes that a high weight is protective for you, and that set point can easily be nudged up in this modern day environment that's really plenty with really rich foods. And so anytime it registers that set point, it naturally sees any departure from that set point as a red flag. And then slowly you get this cascade of events that occurs that prompts you to be hungrier, to have higher cravings, to slow your metabolism in an effort to regain your weight.
When I think about my struggles with food cravings, I always go back to the fact that lack of knowledge was never my problem. I always knew what I should be eating and what I shouldn't be eating. I also knew exercise was a good idea. My biggest challenge was cravings. I find cravings overwhelming and immediate and very hard to deal with in the moment.
People who have obesity are often really sensitive to cravings, even with the sight of visual cues or the smell in a mall of certain food products. There's specific appetite centers in the brain that are responsible for 1, hunger, and 2, wanting or cravings. And the cravings are generated from a place that are seeking out pleasure. We often find that people who have lost weight or are in the process of losing weight will have higher cravings.
I truly believe that this is a journey and that we are dealing with a disease. I came to realize I was using food in a very similar way as somebody living with alcoholism uses alcohol.
When it comes to weight management today, we have hope. There is no longer this need for an endless cycle of repetitive dieting. As clinicians, we used to use diet and exercise in our counseling approaches to weight loss, but the recent 2020 clinical practice guidelines on obesity management are now suggesting that we actually use evidence-based treatments that help bolster somebody's ability to adhere to diet and exercise. And we don't even call it diet anymore, we call it medical nutrition therapy.
Due to stigma and our current beliefs, the perception is that pharmacotherapy is cheating. We now know that using medication to regulate how our body responds to foods is not any different than taking medications to help regulate blood pressure or help patients with ADHD regulate behavior.
And so the three pillars that are suggested are psychological treatments. CBT is something that might be familiar to you for the treatment of mood disorders. And in weight management, we use it to help people regulate their responses to urges, to wanting, to hunger, because we know that people with obesity inevitably get urges. The second pillar is pharmacological treatments. And there are 3 Health Canada approved medications for weight regulation. 2 of those medications are medications that actually help regulate the appetite system, with hunger being blunted and with cravings being dampened. The third pillar is bariatric surgery. Bariatric surgery is the most effective treatment intervention we have to date for obesity. You qualify based on a BMI of over 40 or a BMI over 35 plus comorbidities.
Sandra has found community plays a lasting role in support of her own journey.
The next intervention that I put into my life was being part of a community, and this was incredibly important. Obesity Matters is a nonprofit organization that works to empower people living in larger bodies and living with obesity through education. So we look to educate our community on evidence-based treatment options for obesity, and we have events, both live and virtual, where we bring community together in a safe, non-judgmental space where people feel like they belong.
Dr. Van shares her most important message toward weight loss for patients. It's okay to seek help from your physician.
There are real options. There is hope for weight loss in a sustainable way, without judgment, and in an environment that's supportive and nurturing.
Physicians can also take action and initiate discussions with their patients about weight to help them with evidence-based solutions.
Living in a larger body, living with obesity is so much more than someone's weight or body image. It is a human vulnerability. And when we come to the doctor, we need to know that we're not going to be judged, that this is a safe place, and that we're actually going to use science to treat this disease.
To learn more about weight management, please speak with your doctor or visit the website below, obesity-matters.com.